Hey everybody. I want to talk to you a little bit about shoulder injuries today. One of the things that we experience in physical therapy is just a lot of shoulder injuries. A lot of us are right-handed. Right-handers are a little more prevalent than left-handers, and a typical symptom that people feel is pain in their anterior aspect of their shoulder, which is right through here. They'll feel it right up in this particular area here. And this is the attachment for one of the biceps tendons, which actually causes a couple of movements. It causes the shoulder to flex and it causes the elbow to flex. So typically when ball players are throwing, they're throwing through here, and many of them tend to throw the ball with their elbow above, actually below 90 degrees, and they should be throwing it where it's above 90 degrees. So sometimes when a guy's throwing a ball, he's throwing it down through here, he's putting his rotator cuff, which is the muscles in the back, in a bit of a disadvantageous position and requiring a lot more work from his bicep. His bicep, as well as the ball is being thrown, has to help decelerate the arm along with the rotator cuff muscles. There's a muscle called the subscapularis muscle that starts to decelerate the arm when the ball is being thrown this way. And that muscle is in your armpit. And that muscle gets tight quite a bit. So what muscles are the key muscles of strengthening are your rotator cuff muscles. Many of us have seen athletes, and probably you guys do it in the gym, is you do external rotation exercises. These are very vital exercises to do, and basically grabbing a band or a pulley and moving your arm out, not pulling in, you're pulling it outward. So the band would be here and you're pulling the band out. The resistance will cause tension in the back of your arm. And that should be done through different ranges. So you have it at the position where you right your elbow, at 45 degrees, and at 90 degrees where you could do this particular motion. Remember, the rotator cuff muscle is an endurance muscle. It's not a strong, powerful muscle like the quadricep or the hamstring. It's an endurance muscle. So as you're throwing the ball frequently, you'll find that a lot of people will have weakness and dysfunction that occurs over time. Is because the ability for the muscle to endure time and in relation to activity, in velocity and throwing, creates dysfunction and muscle imbalances. Many times people have labral issues and rotator cuff issues, rotator cuff impingement, and have other issues and tightnesses. But the key thing is to make sure that you stretch out your pec muscles. Don't do too many pec exercises at the gym. A lot of guys, and they want to have strong bench presses, but that's going to also throw off your throwing. A lot of heavy bicep curls too will create some rotator cuff dysfunction. And in general, when you're laying down on the bench, a great exercise to do is a serratus anterior, what we call a supine press-up, where you hold the dumbbell in your hand. If I'm laying on my back, you hold the dumbbell in your hand in front of you at 90 degrees, and you push toward the sky. I'm doing it in a seated position. I have a table in front of me here to do that, so I'm doing it in a seated position, and you're pushing out toward this way, in that direction. So if I was laying down, it'd be right towards sort of the ceiling, and you want to use about 7-8 pounds to do that, and you want to have sustained motion with that. That works your serratus anterior muscle, which helps stabilize your scapula to your rib cage. And your scapula is a bone in the back of your shoulder. I'm being layman. I know there's a lot of physicians and other very intelligent people in our league, but there's a lot of people that do know this, but your scapula is a bone that glides on your rib cage, so it doesn't have as much stability. So anytime you have something that doesn't have as much stability and more mobility, the key thing is to continually stabilize it. So there's many things you can do to continue to stabilize that, and there's other videos like on YouTube that you can see to stabilize your scapula, so scapula stabilization exercises. And these things are very vital to do right when you start to feel any symptom of pain in front of your shoulder. A lot of guys will tell me they've been having pain in their shoulder for years, or they say it's getting worse. I, for one, have had pain in my shoulder for a long time, and still do, and most likely from a labral issue, but you'll find that it weakens the rotator cuff over time. So it's very important to keep that aspect of your shoulder in the front loose and the aspect of your back, your posterior shoulder, strong. And that's a little tip for your rotator cuff.